So someone wanted to know about optic nerve tortuosity. And tortuous is different than tortuous. Tortuous is torture. Tortuous is squiggly like this. And it can be defined mathematically. So when you have a circle, the arc subtended, it can be defined as an angle. And so we can have a difference between the chord length and the arc length. And so when you have a difference between the arc length and the chord length, that defines tortuosity. So the closest distance between 2 points is a line, but if you put more line in there, you'll get more area. And so that is the basis of tortuosity in general. You're trying to put more road in the same distance. And the road is usually a vessel. So if you have ischemia, the blood vessel wants to get bigger and cover more area, so you become more tortuous. Or if you increase the pressure differential is not the same in a vein as in a rigid pipe. And so that differential flow will make it tortuous because the pressure is not the same throughout, because the flow is different in the pipe. So in distensible pipe systems like vessels, or in this case, the optic nerve sheath, you can get tortuosity. And so in a normal person, there is already tortuosity built into the system. The reason is, if you're looking straight ahead versus looking to the side, if you make this a straight line, the nerve will get pulled. And so we have to have some play in the system to allow the eye to rotate so that we don't get an optic neuropathy from stretching the optic nerve. So this little extra bit of tortuosity provides us with some play in the system when we look to the right and to the left and up and down. So tortuosity is a physiologic finding. It's a normal finding in patients with optic nerves because there's fluid in the sheath. And if you have increased fluid in the sheath, just like increased pressure in blood vessels, it can produce increased tortuosity. And so that's often seen in increased intracranial pressure, like in idiopathic intracranial hypertension, IIH. There's going to be more tortuosity in the sheath because you have more fluid in the sheath, and more fluid leads to more tortuosity. The other area we see tortuosity is if you have more stuff in the optic nerve. So if you increase the road surface area, you'll get tortuosity. So that's sometimes seen in patients who have tumors of the optic nerve, like NF type 1. Or if you have an occlusion that's blocking the fluid, it will also increase the tortuosity. So even though tortuosity is a physiologic finding, too much tortuosity might be too much stuff, too much nerve, or too much fluid. The most common thing that we see is increased intracranial pressure, and most commonly idiopathic intracranial hypertension increases the tortuosity because increased fluid in the sheath causes it to be more tortuous. And it could be too much nerve, that's neurofibromatosis type 1, tumors, meningioma, glioma also cause tortuosity. So you need to know a little bit about tortuosity of the optic nerve.